oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. 30 independent assessors from Accreditation Canada are reviewing our hospitals this month, Mr. Speaker. They are comparing our hospital results to national standards for such important healthcare services as mental health, emergency rooms, and surgeries. This is a very important matter, Mr. Speaker. Nova Scotians deserve an independent, straight-up assessment of how things are going in our hospitals. However, noted healthcare advocate Alan Lynch has just published a report entitled Compromised Accreditation, which I will table for the House, which reports that in the case of the Valley Regional Hospital, Nova Scotia Health Authority management has circulated the accreditation questions to their staff in advance with pre-approved management answers. This is a serious allegation, Mr. Speaker. I would like to ask the Premier if he or his government is aware of the allegations being made about the accreditation.
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. Indeed, I want to thank all those healthcare workers across the province who are in the institutions that are providing primary care to our families and emergency care when we require it, Mr. Speaker. I also want to tell the Honourable Member this is a standard practice that our institutions have accreditation, but I have no knowledge of the allegation that the Health Authority is sending out answers to questions that may come up. Mr. Speaker, one of the things that I have discovered in my short period of time in this House is that Nova Scotians will be very direct and honest and upfront with the opportunities and challenges that are facing them in their workplace, and we'll all in this House work together to make sure that we have the appropriate environment.
The Honourable Leader of the Official Opposition on his first supplementary.
Well, Mr. Speaker, if the Premier truly wants to thank the healthcare workers of this province, as we all do, then I would say this: let them speak. Tell their managers to let them speak freely about what's going on in our hospitals to the independent assessors who are here checking on their accreditation. These are the people, Mr. Speaker, that deliver mental health services, that work in our emergency rooms, that book and perform important surgeries. And we are being told, Mr. Speaker, that they are given pre-approved answers to questions from their bosses, Mr. Speaker. We'll never get anywhere in this province if that kind of thing goes on, Mr. Speaker. So will the Premier direct the Health Authority today to back off and let our healthcare workers speak the truth to the accreditors about what's going on in the state of our hospitals?
The Honourable Premier.
Speaker, I want to again thank the Honourable Member for the question. There's a number of assumptions on his part, Mr. Speaker. First of all, his allegation that he's putting on the floor of this House, he doesn't know if it's accurate or not. Furthermore, Mr. Speaker, I want to remind the Honourable Member and tell the Honourable Member I have all faith in healthcare providers across this province who will be direct and honest and upfront with the accreditors who are in this province to ensure that the environment they're working in, Mr. Speaker, is the environment they want to be in, and it reflects the values and that they believe all Nova Scotians want in their institutions, and it reflects the care that Nova Scotians deserve, Mr. Speaker.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, no wonder this is a government where the employees that work for them report record low scores on job satisfaction. When they see independent assessors come to this province on something as important as healthcare, and they want to speak the truth so we can actually start to move our healthcare system forward, Mr. Speaker, the Premier has a duty to know that our accreditation is legit and is not managed with more spin, Mr. Speaker. So I'd like to ask the Premier, what steps has his government taken to ensure the accreditation process is fair and unbiased?
The Honourable Premier.
Mr. Speaker, the people who are doing the accreditation analysis, Mr. Speaker, are independent from government. They're coming in to have a look. They don't only look at this province, they look across the country, Mr. Speaker. I have all the faith in the world in healthcare providers who will continue, Mr. Speaker, to speak to anyone who comes into our facilities and let them know the challenges and the opportunities, quite frankly, that exist in this healthcare system. We've had Mr. Speaker, while there may have been challenges over the last 4 years, Mr. Speaker, when it comes to delivering services to the people of the province of Nova Scotia, one of the things that I'm very proud of. The public sector workers from one end of this province to the other continue to work with our government to ensure that frontline services will be there for Nova Scotians.
The Honourable Leader of the New Democratic Party.
When I was previously in this House from 2009 to 13, I worked from a constituency office that was very busy. Our phone rang all the time. We often had people waiting. Yet in all that time, I only recall one resident having come to that office for help finding a doctor, and that, Mr. Speaker, in fact was somebody who was coming looking for my physician brother. But in the few months since I've represented Halifax-Chebucto, looking for help finding a family doctor is the single greatest subject of all of our constituency casework. Does the Premier see that this situation reflects the deterioration in the availability of health care in Nova Scotia since his government came to power?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable for his question. The budget that he voted against, Mr. Speaker, had in it 10 residence seats that be added to the 35 that exist currently at Dalhousie University. There will be another 10 residence seats, Mr. Speaker, that will be there for foreign-trained doctors to get accreditation in our province. The budget he voted against had money in for 70 collaborative care centres across the province to bring together primary care health care teams, nurse practitioners, family practice nurses. Mr. Speaker, in some parts of this province, I believe a social worker should be part of that health care team. Continue to work forward to make sure that they have access to primary care, and we'll continue to make sure. Are there issues in pockets across the province? Of course there are, Mr. Speaker, as there were when that honourable member sat on this side of the House, and we're going to continue to find a long-term solution by ensuring that we have the appropriate number of seats at Dal Medical School to be able to ensure that we're turning out enough family physicians to practice in this province.
The Honourable Leader of the New Democratic Party on his first supplementary.
Thank you. The Premier has been in office for 1,463 days. After all that time, we face a situation today where a Lockport mother of two, looking at the longest diagnostic mammogram wait times in the province, receives a more timely appointment only after going public with her situation, and where a Sydney Mines mother of four, media report, is facing selling her home to get care in the U.S. in face of long neurosurgical wait times. And yet every time throughout this session, Mr. Speaker, I've asked the Premier about the health care question, he makes primary reference to the government which preceded him. So I want to ask the Premier, is 1,463 days not enough time for him to take responsibility for his own health care record?
The Honourable Premier.
Again, I want to thank the Honourable Member for his question. Mr. Speaker, we've continued to invest in primary health care across the province. As I told the Honourable Member, there will be 20 new residence seats in this province to ensure that we have access to the training, to ensure that those physicians are here. Collaborative care centres and nurse practitioners that will be associated, Mr. Speaker, in the collaborative care to provide healthcare delivery model. If you looked at the investments we made in Schools Plus in and around adolescent mental health, Mr. Speaker, but not only did we do that, Mr. Speaker, we provided the largest single tax cut in the history of this province for low-income Nova Scotians, Mr. Speaker. We invested the $56 million that government cut out of classrooms back in classrooms, Mr. Speaker. We continue to provide opportunities, Mr. Speaker, for young Nova Scotians. In the last 2 years, we've had more young people move into this province and leave, Mr. Speaker, the largest number since 1990, Mr. Speaker, and we're going to continue to move forward to deal not just with one single issue, Mr. Speaker, but all of the opportunities that face Nova Scotia.
The Honourable Leader of the New Democratic Party on his final supplementary.
Thank you. A Kijiji want ad was placed a few weeks ago under the title, "Family Doctor Needed ASAP." The ad's author had just moved home to Halifax from the U.S., and describes having to send their spouse back to the States in order to get their prescriptions filled. Mr. Speaker, another day, another absurdity in the world of Nova Scotian health care. In order to solve a problem, you have to be able to see it. So I want to ask the Premier, why can't he see that our health care system in Nova Scotia is in a state of crisis?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member again for the question. Again, I want to repeat what I've said to him already. We identified, Mr. Speaker, the shortage of family physicians. This is why we've gone towards, Mr. Speaker, adding those 20 residency seats to ensure that we're continuing to have a supply of family physicians to this province. That's why we continue to advance primary care, where we know the new young physicians want to be part of, along with a collaborative care team. As I said to him, I believe a social worker should be part of that, Mr. Speaker. The challenge for any government, Mr. Speaker, is you can't ignore what happened before you got here, Mr. Speaker. They ignored the real challenge. We're putting in place long-term solutions to the challenges facing our communities.
The Honourable Leader of the Official Opposition.
Mr. Speaker, it turns out that providing pre-approved management answers to staff to give to the accreditors of our hospital is not the only problem to surface. It's also been reported that a health authority manager in Pictou County once stood over his staff as they filled out the accreditor survey. Now, how can we get an honest assessment of our healthcare system from that, Mr. Speaker? The Premier says he has faith in our assessors. We want to make sure that those people assessing our hospitals get the straight goods, Mr. Speaker, that they get the truth. So I'd like to ask the Premier, will he take steps today to ensure that the accreditors that are visiting our hospitals are getting straight goods from the people that provide healthcare services and not pre-approved answers from their managers?
The Honourable Premier.
Thank you, Mr. Speaker. Mr. Speaker, there's a whole bunch of assumptions in this question, Mr. Speaker, but the one that I think I want to tell the member for Pictou East, the leadership will be up soon. He can start campaigning then. If he just reminds his seat, let me have an answer, Mr. Speaker.
Order, please. The Honourable Premier has the floor.
Tell the leader of the official opposition, quite frankly, Mr. Speaker, of all the faith in healthcare workers across this province, to be frank and upfront with the assessors as they are with their managers, as they are, quite frankly, with their government when they see challenges and opportunities.
The Honourable Leader of the Official Opposition.
Mr. Speaker, a government that had faith in healthcare workers wouldn't give them pre-approved answers to the questions that they're being asked by people that are determining whether we're meeting standards in mental health or standards in our emergency rooms or national standards, Mr. Speaker, in our surgeries. They wouldn't need to give them pre-approved answers because they would just be told to speak freely so we can at least get to the bottom of what's gone wrong in our healthcare system, Mr. Speaker. So I'm going to ask the Premier, how can he assure Nova Scotians that we're meeting the national standards of delivery in healthcare when he won't even look into these serious allegations that have been published this week?
The Honourable Premier.
Mr. Speaker, again, Mr. Speaker, I want to thank the Honourable Member for the question. I want to assure the Honourable Member that the Minister of Health will investigate the allegation. I think it's important in this room and in the floor of the House of Assembly. It is an allegation, Mr. Speaker. But again, in a number of his questions, he made a whole host of assumptions about healthcare workers across this province, Mr. Speaker, that I don't share. Quite frankly, they've been upfront and direct with our government. They've been upfront and direct with, Mr. Speaker, with their supervisor, and I fully expect them to do the same, being upfront and direct with the accreditors that come into this province, because they know how important it is that the appropriate information get to our accreditors so we continue to improve the healthcare system in this province based on fact.
The Honourable Member for Dartmouth South.
Mr. Speaker, my question is for the Minister of Education. On October 11th, we learned that a knowledgeable expert, Dr. Avis Glazed, had been hired to conduct an education system administrative review. Despite the very short timeline, both the Minister and the BC-based expert said they were coming to this review with an open mind and were interested in listening to all stakeholders. Yesterday, we found out that parents and members of the public will have 10 days to provide feedback through an online survey with 3 broad, vague questions. In the midst of packing lunches and taking kids to school, I wonder how many parents will find the time to engage with this process. Mr. Speaker, does the Minister think the concerns of parents will be adequately captured in this manner?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. We are very proud to have found Dr. Glaze, who is a world-renowned expert in these matters. We are taking leadership on the questionnaire, on the timeline for it from her. She is currently out meeting with board representatives and communities as we speak, and of course the public has another venue via the internet to submit their thoughts on the administrative model, Mr. Speaker. I think that any parent that has an interest in this will take the time to fill out that survey and ensure that their views are properly heard in this process. Thank you.
The Honourable Member for Dartmouth South.
Mr. Speaker, I wonder about parents who don't have access to the internet and who are already disadvantaged. In this government's first mandate, they commissioned the Freeman Report, which made 30 recommendations based on 19,000 completed surveys. The final report from the Commission on Inclusive Education is due March 18th. Extensive consultations on pre-primary are expected to begin in the next few weeks. Last February, thousands and thousands of educators and parents and members of the public came to this legislature to voice their concerns about the administration of the education system. Unfortunately, members of this government were not there to listen to them. Mr. Speaker, how many times and in how many ways do parents have to express their concerns before this government will listen to them?
The Honourable Minister of Education.
Mr. Speaker, this process is a continuation of the Myra Freeman Report. In fact, she had a recommendation to review the structural model. We have not just heard from parents, we've heard from teachers and students who have identified a number of challenges in the system, Mr. Speaker, which we are all tackling systematically. The system of inclusion, early learning, our administrative model, and classroom conditions which impede teachers from focusing on teaching, Mr. Speaker. These are the focuses of our government based on the feedback we've had from the public, and we are not going to waste a day in bringing forward transformative changes that will have a positive impact on the lives of our kids. Thank you.
The Honourable Member for Pictou West.
Thank you very much, Mr. Speaker. My question through you is to the Minister of Justice. And An investigation into the Mother Risk Lab conducted by the Fifth Estate and the Toronto Star featured a difficult Nova Scotia story, and I'll table that story. Mr. Speaker, a Halifax couple lost custody of their son based in part of a mother risk testing. When the father paid an accredited U.S. lab to test his hair, it came back clean. But it was too late, Mr. Speaker. The couple's son had already been adopted. So I would like to ask the Minister how many Nova Scotia families were damaged as a result of faulty, unreliable mother risk hair testing.
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and my colleague with Community Services will respond to that question.
The Honourable Minister of Community Services.
Thank you, Mr. Speaker. I want to assure the honourable member and indeed all Nova Scotians that we take child protection, child safety very seriously. I want to assure Nova Scotians that in any determination, hair strand testing would have been one factor. It would never have been the determining factor in a custody case, and I want to assure all members that as soon as we learned of the issues with mother risk, we discontinued their testing. The following year, all hair strand testing was discontinued. Thank you.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. I am aware that last year the minister, past minister, indicated that yes, there was no more communication with mother testing, mother risk testing. However, there were incidents in Nova Scotia, not just the one I just spoke of. There were many actually, and the minister said government would not conduct a blank review like Ontario because of the extraordinary amount of human resources a review would require. But my question is, given the results of the mother risk lab tests, and they have proven to be so unreliable in court where people lose their children, will the minister review all the cases where mother risk test results were a factor?
The Honourable Minister of Community Services.
I want to assure the honourable member that we're just finalizing the parameters of our review. It will not just be of the cases where mother risk was used, Mr. Speaker. It will also include any case where any hair strand testing was done. I want to assure the honourable member and the members of this House and Nova Scotians that if anyone wants us to review their case in the meantime, they can approach Community Services and we will do that. Thank you.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister responsible for rural internet. We spoke about the challenges that rural folks, many people all across Nova Scotia have accessing proper internet speeds. I'm hearing from constituents that are receiving fee increase notices from their service provider that their fees need to go up to upgrade the network from speeds of 5 to 10. When they ask the provider what speed they're on now, they're on 1. So they're trying to figure out why are we paying for an upgrade from 5 to 10 when we're even on 1. So I guess the question for the minister is he aware of the fee increases, and what can he say to people who don't have adequate internet about when they might get it?
The Honourable Minister of Service, Nova Scotia.
Thank you, Mr. Speaker, and I thank the member for the question. He did make me aware of some of the concerns and certainly complaints coming from his constituents. Obviously, with the importance of the broadband file, the staggering amount of investment that we'll make as a province over the next 5 years, the fact remains that we've got to work with our providers and ensure that the customers, the clients, the people across this province are getting adequate service. They're paying adequate fees for the level of service that they're receiving. So with respect to the specifics, I can certainly check if the member wants to get me details on that particular constituent. We can check the fee structure and why that's taking place. And again, on the broader sense, we're very much aware that the provincial government, the national government, that we've got to make major investments on behalf of our people to ensure that we're connecting Nova Scotians and having access to internet that provides support for people and support for building the economy. Thank you.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. I thank the Minister for that answer. Maybe the Minister can shed a little light on the subject for the House as to when the money that's been allocated will start to be spent, and specifically when will we see the network start to be built out and built up in rural Nova Scotia to improve speeds. Thank you.
The Honourable Minister of Service, Nova Scotia.
Thank you, Mr. Speaker, and the answer to that is immediately. Our $14.5 million, which per capita is one of the largest investments in the Federation in terms of our provinces. That will begin immediately. Obviously, my colleague with Municipal Affairs has had a number of conversations with our municipalities across the province about what their priorities are for building that middle mile capacity. And then it's the Connecting Canadians program with the federal government. We've got to leverage those federal dollars. So in partnership with the 3 levels of government, with the private sector fibre operators who are building that capacity, and of course the many satellite entities and organizations that have come looking to Nova Scotia for a place to develop and grow their products. So there is a lot of work, there's a lot of planning, but at the end of the day, this is going to take a major investment, and the province of Nova Scotia will be there to make that investment. Thank you.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Community Services. Mr. Speaker, Colin Potier, a constituent of mine, told me he is at high risk for contracting shingles. Mr. Potier would like to receive the vaccine to help protect himself, but he cannot afford it. The gentleman receives income assistance, and the $211 vaccine is far too expensive given his fixed income. And the vaccine is not covered in the pharmacare program for those on income assistance. Can the Minister inform this House why this important vaccine, the shingles vaccine, is not covered in the pharmacare program for those on income assistance?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I would be happy to sit down with him and look at this particular case. Thank you.
The honourable member for Kings North.
To thank the minister for that answer. Mr. Speaker, anyone who's ever had chickenpox can develop shingles. The shingles can be incredibly serious and could have a significant impact on a person's health, but the province will not provide additional funding to protect those on IA. My constituent believes, since he is at high risk, that the vaccine could actually save the province money given the high cost of treating shingles. Will the minister act to help Nova Scotians on income assistance and at high risk to protect themselves from shingles?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker, and I want to assure the honourable member I will sit down with him and we'll take a look at this. Thank you.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, the board that runs the Whitney Pier Rink went to the media last week about their budget shortfalls. Without government assistance for a large power bill, the board will not have funding to operate the rink for this season. The board needs that money by the end of this week. My question to the Minister of Municipal Affairs: will the minister provide the $20,000 needed so the Whitney Pier Rink can operate for this season?
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. I'd like to thank the member for the question. I've been working with the Whitney Pier Rink since last February when they approached my local office for some of the challenges that they were facing with operations. Since that time, we've worked closely with them to try to hold local fundraisers with them to try to support some of those operational challenges that they have. In those conversations with them, I was quite clear with them that we provide a number of grants throughout the community that we've been successful with in Whitney Pier, but specifically with what their ask was to the media with paying a power bill. There's no grant envelope that covers operational costs.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, we know how important community rinks are all across the province. They are a gathering place for families and provide access to recreation activities to Nova Scotia seniors and children alike. Perhaps if the minister hadn't moved his office out of the Whitney Pier area, he would have had more opportunities to hear from the folks how important the rink is to them. Mr. Speaker, why is the minister standing by and allowing the Whitney Pier Rink to close?
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. I can stand in my place today as the MLA in Sydney Whitney Pier and say we've done a tremendous amount of work to support organizations in the pier. Mr. Speaker, I stand in my place to say that we supported Chester Borden with close to $100,000 so the youth of Whitney Pier could have a new youth club. We supported the Ukrainian Church Hall with $50,000 for their community facility. We supported the new St. Mary's Polish Church. We supported St. Michael's Polish Hall. We supported the Whitney Pier Historical Society to support the cultural significance of Sydney Whitney Pier. And we supported Whitney Pier Rink since day one, working with Nova Scotia Power to work out a payment plan, to work out fundraisers to help them support that. We will continue to do that as a local office to support the Whitney Pier Rink and support any organization in that community. But the specific ask that they asked for with the power bill, we can't pay that under a funding envelope, but of course my local office is there to support Whitney Pier Rink and any other organization that requires my help.
The Honourable Member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, in May of 2015, it was announced that the 18th Century Perkins House Museum in Liverpool, one of this province's oldest museums, would be closed due to structural problems. In March of 2016, the Liberal government said it would repair and reopen the museum. Sadly, this did not happen, and the museum had to remain closed for another season, which would have marked the 250th anniversary of this historical home. On April 23, 2017, 3 days before the election call, the government announced that they would make the necessary repairs and renovations this year. My question to the Minister of Community, Culture, Heritage is, given that there are only 2 months left this year, have the design work and renovations started yet? Have you met the deadlines that were set in April? And is it still the government's intention to have the Perkins House open in 2018?
I'd like to remind the honourable member not to pose questions directly to members opposite, to keep your comments through the chair. The Honourable Minister of Communities, Culture and Heritage.
Thank you, Mr. Speaker. I guess the 50-second answer is as follows. Yes, we've taken a very considerable look at Perkins House, and in order to restore it to its original condition, it does need that expertise to go and take a look at the proper drainage system around the home, how in fact it can be kept intact as close to its original condition. And I can guarantee the member that this design work and the plan to have this available to the citizens of Liverpool and all Nova Scotians is well in hand.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. So I guess that means it's not going to be repaired by 2018. Mr. Speaker, in 2015, it was stated cost to repair the Perkins House was estimated at $550,000. Government announced in April that estimated costs of the Perkins House renovations ranged from $1 to $1.5 million. Now that 5 full months have passed and design work and renovations were slated for this year, are they now prepared to commit to an exact monetary figure, or will this figure continue to rise because of the inaction of this government?
The Honourable Minister of Communities, Culture and Heritage.
Thank you very much, Mr. Speaker. When you get a structure and a heritage building such as Perkins House, there were 2 views. One wanted the Disney World version, something that looked like Perkins House. What we're going to do is restore Perkins House to its original shape, irregardless of cost. Over the next 2 years, people will be going back to Perkins House.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker. My question is for the Minister of Community Services. Individuals in need of financial support through the Disability Support Program require a family doctor to sign off and prove their disability in order to qualify for funding. I have a constituent who is unable to work due to a PTSD diagnosis. Unfortunately, this individual is among the many thousands in this province who does not have a family doctor, and his mental health professional is not qualified to sign the forms. Knowing there is a shortage of family doctors in this province, will the minister look into creating more flexibility in who can sign off on disability support forms?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. There is no doubt that some people are having difficulty accessing family doctors at this time. Some are able to find some alternative ways to do this, but I would be happy to sit down and see if we can assist your particular constituent to find a family doctor. I know that in my own constituency, this is work that we carry out for our constituents. Thank you.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker. My follow-up question is for the Minister of Health. In my constituency, I have people unable to receive child tax benefits, disability support funding, and being forced to face shockingly long wait times for appointments and treatment, all because they don't have a family doctor. The negative impact of being without a family doctor spreads far beyond the ability to receive basic medical care. On November 1st, Dr. Gregus, who has over 1,500 patients in his downtown Dartmouth office, will be retiring. He not only works in his practice, but also in the walk-in clinic, so wait times are set to increase even more. Mr. Speaker, when will this government and minister finally admit there is a healthcare crisis and commit to a long-term plan to recruit family doctors?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Indeed, Mr. Speaker, I believe I and the Premier and other members in this side of the Legislature have stood on numerous occasions, Mr. Speaker, to advise this House, Mr. Speaker, and all Nova Scotians that indeed our budget that we tabled demonstrates our commitment to recruiting physicians and primary care providers, Mr. Speaker. We're adding to the residency program where we know that when a resident performs the residency part of their studies, Mr. Speaker, that they have a high probability of staying in the province to complete their studies, Mr. Speaker. We're doing international recruitment and supports there, Mr. Speaker. We are committed to improving primary care access to all parts of the province, Mr. Speaker, whether that's in Cape Breton, in Metro, Yarmouth, Antigonish, and all points in between. Thank you.
The honourable member for Inverness.
Speaker, a question for the Minister of Health. Over a year ago, home care agencies from the Eastern Zone submitted a proposal to the Department of Health. Mr. Speaker, they're trying to be as efficient as they can by working together to meet key performance indicators. 6 months from now, new contracts will be issued to provide home care service. Will those contracts recognize the difference in providing home care in rural areas versus urban, knowing that geography and weather impact the performance of agencies delivering the service?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the member raising this question. It's a very important question with respect to home care services. We recognize as a government the importance of providing continuing care services in the last number of years, and it's a continued commitment to expand our supports for home care services where many seniors of province want those services. But an important part of that is ensuring that the services they receive are the best possible quality, that we're able to assess, that we're providing the same level of service across province. That's where the key performance indicators come into play, Mr. Speaker. What we've been doing is rolling those out and providing time to work with the service providers that are currently in place, to work with them to identify and assess how well these key performance indicators are working within the system.
The honourable member for Inverness.
Mr. Speaker, there's nothing wrong with indicators, but we have to make sure that apples are being compared to apples. And rural versus urban they're two different ball games, Mr. Speaker. There's only so many variables managers can work with to control costs. Some of them are outside of their control. And I think of cancellations due to weather and road conditions as one example. For this reason alone, the dollar per direct service hour indicator can vary widely between rural and urban areas. Come April, what is the government's plan to continue providing home care service if existing service providers cannot meet these performance indicators?
The Honourable Minister of Health.
As I said, Mr. Speaker, I thank the member for the question. Again, one of the important things, this is a transition, it's a new approach, Mr. Speaker, to working with our home care providers and the partners that provide these services, these valuable services to Nova Scotians, both rural and urban across the province. And Mr. Speaker, that's why we took the time to develop key performance indicators based on information that reflects best practices, Mr. Speaker. But in addition, we recognize this is a change in the way of operating and how home care has been delivered in the past. It is a change for those organizations and for indeed for the government, Mr. Speaker, in providing these services. So an important part of that step was working with the service providers, assessing how they're performing against those standards, so that if we need to make changes or how we respond, we get that information and we do so accordingly. That's why we phased it in.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. In budget estimates, I asked the Minister of Labour and Advanced Education if any gender-based analysis had been conducted around government's decisions, including funding tuition for apprentices returning to the classroom for technical training. The minister said that no such analysis had been done, but this is troubling, Mr. Speaker, because according to a report from the Nova Scotia Advisory Council on the Status of Women, since the year 2000, on average, only 2% of registered apprenticeship and trade qualifiers in Nova Scotia are women. So my question, Mr. Speaker, today is for the minister responsible for the status of women. Could she please table a list of all government policies and spending commitments that have undergone a gender-based analysis?
The Honourable Minister responsible for the status of women.
I want to thank the honourable member for the question, and I want to assure her that we have had training undergone by civil servants, so they know how to do gender-based analysis. And in fact, when MACs do go to cabinet, memorandums to Executive Council go to cabinet, there is a place to account for that, Mr. Speaker. I would note, Mr. Speaker, that the previous Minister of Labour and Advanced Education worked very hard to encourage more women to enter the trades, as does the current minister, and we will continue to do that because we know, Mr. Speaker, that a trade is a great career for a woman. Thank you.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker, and I thank the member for that answer. Mr. Speaker, women in Nova Scotia earn less than men. They're more likely to work part-time and more likely to do more hours of unpaid care work. The government has a responsibility to understand how public spending will impact women and men differently. This year, the federal Liberal government produced a budget that looked at some of these differences, recognizing that gender-based analysis is an important tool for developing effective public policy. So this time, I'd like to ask the Premier, is he willing to commit to a full gender-based analysis of all future provincial government budgets?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. I want to tell her how much I enjoyed this morning, Mr. Speaker, celebrating with the status of women their 40th anniversary. I also want to tell the honourable member how proud I am of my daughter, who was, as many of the people in this house would know my daughter, who was a page in this house, and my son, and how much I worked extremely hard to ensure that she recognized the same opportunities that he saw were there for her. Mr. Speaker, I would encourage anyone to enter the trade system in this province. Mr. Speaker, quite frankly, you become the Premier if you do. But I also want to say to the honourable member, when she had an opportunity to be in government, Mr. Speaker, they appointed 10 people to the bench in this province. 8 of them were men. Mr. Speaker, limited minority representation. I'm very proud of this group of men and women on this side of the House, Mr. Speaker. The next appointment will bring gender parity to the bench in Nova Scotia. I want to tell the honourable member, Mr. Speaker, when she looks at the executive team in the province of Nova Scotia, Mr. Speaker, there are more women in executive at the DM level than there are men, Mr. Speaker. That's, Mr. Speaker, what this government believes in gender equality. We're, Mr. Speaker, putting our money where our mouth is, Mr. Speaker, and advancing our daughters where they should be, Mr. Speaker, a rightful place.
The honourable member for Sackville, Beaverbank.
Excuse me. Thank you very much, Mr. Speaker. Our office has received a call from a constituent who's been unable to obtain a physician for elderly parents, so they must attend a walk-in clinic. Unfortunately, both require specialist care, but walk-in clinics do not refer patients for specialists. The only recourse for this elderly couple is an already overburdened emergency hospital room where they have to sit and wait and wait and wait. Mr. Speaker, my question is similar to that to the member of Dartmouth East and to the Minister of Health is, what is the Minister doing for patients such as these two who are falling through the cracks and are in desperate need of ongoing care?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Indeed, as the member would know, the government has recognized the need and our commitments to improve primary care access for all Nova Scotians, Mr. Speaker. That's why we committed in this budget, Mr. Speaker, as part of our efforts around primary care, to expanding access to residency seats, which provide opportunities for medical students to complete their training here in the province of Nova Scotia. We know, Mr. Speaker, from past residents that have gone through the system that a high proportion of them, I believe somewhere in the vicinity of 70%, stay in the province of Nova Scotia where they practice. Mr. Speaker, we commit to the collaborative care practices, which allows, Mr. Speaker, also nurse practitioners, family practice nurses, social workers, many other healthcare providers to come together, work together to provide the best possible primary care service for all Nova Scotians, and all of those efforts, Mr. Speaker, are underway.
The honourable member for Sackville-Beaverbank.
Yes, thank you very much, Mr. Speaker. Mr. Speaker, I have no doubt that this government does believe that they are doing things to help the health care, but the reality is there is a crisis across this province. And, Mr. Speaker, you can't use Band-Aids for amputations, okay? Stories like this are far too common. I'm getting calls every day from people in my constituency, Mr. Speaker. Nova Scotians are not able to get health care when they need it. They've exhausted possibilities. Mr. Speaker, I want to know what measures the minister will put in place so that Nova Scotians without family doctors will have access to specialist care. Thank you.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As I said, Mr. Speaker, we've expanded the residency practice. The follow-up questions speak specifically about specialist care. Mr. Speaker, that work includes commitments to provide additional specialist residency positions as well. So both family practice providers, Mr. Speaker, and specialists, there are increases for residency positions, Mr. Speaker, providing more opportunity for people to come here to Nova Scotia to get their training here, Mr. Speaker, in the medical profession, to provide those services to Nova Scotians that need it. So, Mr. Speaker, again, we are taking those steps, and they are underway now. Thank you.
The honourable member for Colchester, Musquodoboit Valley.
Thank you, Mr. Speaker. My question is for the Minister of Education. I met with parents of Dutch Settlement a week ago yesterday at the elementary school in Dutch Settlement. They expressed concerns respecting the safety of the children. The parents have tried to bring attention to these concerns, but to no avail. They feel as though the school in Dutch Settlement is just one of those forgotten schools. Can the minister check into the status of the Dutch Settlement School with respect to future plans?
The Honourable Minister of Education.
Absolutely, Mr. Speaker, and I'm happy to sit down with the member and go over the safety concerns of that community and make sure that they are properly addressed within the system. Thank you.
The honourable member for Colchester, Musquodoboit Valley.
I was there to see the concerns firsthand. They are warranted, in my opinion. They seek a crosswalk for students who walk to school, and there's one driveway. That means cars going in and cars going out in the same driveway, and it is in deplorable shape. So again, I'm going to ask, would the minister cause a staff member to assess the concerns?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Specifically, what I'll be able to do is to direct the department to see if those capital requests have come in through the school board. The process that we currently have in place does require that the board present capital expenditures to us on a priority basis, so we will review to see if those requests have come in. If not, I would urge the member and the community to reach out to the local school board to make sure that capital requirements are on the list, and that will allow the department to act. Thank you.
The honourable member for Cumberland North.
Mr. Speaker, Cumberland North contributes to a large export sales for the province of Nova Scotia, yet I know we're only scratching the surface of our economic potential. We have 30% of the arable farmland in Nova Scotia, but too much of it is unused and growing up in alder bushes. I believe with the support of many government programs through the Department of Agriculture, we can grow this sector. However, currently we have absolutely no employees of the Department of Agriculture in Cumberland, despite having 30% of the province's arable farmland. The question to the Minister of Agriculture is, within your $42 million budget, could we have some employees physically working in Cumberland County to support the growth of this agriculture sector?
The Honourable Minister of Agriculture.
Thank you very much. It's a very important question. We have outreach workers that work all over the province of Nova Scotia, and indeed they do go to your riding and on a regular basis and talk to the farming community there. And it's important that we do that at outreach all the time, and we'll continue that work.
The honourable member for Cumberland North.
Thank you, Mr. Speaker. And with all due respect, it's not the same. When someone's working physically in an area, they're much better able to serve that area than when they're physically located in another sector. And I truly believe if we had employees working right in Cumberland County, it would better serve our industry. I do want to bring up one other important topic that a farmer came to see me about, and that is the issue that innovation and technology, sometimes our regulations and laws don't keep up with it. So he was stopped for speeding on the highway driving his tractor. He was going 60 kilometers an hour, and the laws state he is not allowed to go over 40 kilometers an hour. So this law was introduced years ago when tractors were much slower. So I'm wondering, would the minister work with either TIR or the Department of Justice to correct and amend these laws to allow farmers to drive faster than 40 kilometers?
The Honourable Minister of Agriculture.
I'd be very pleased to take that up with the Minister of TIR.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Speaker. My question is for the Minister of Municipal Affairs. The City of Halifax is set to consider commuter rail as part of the overall integrated mobility plan. The study, Mr. Speaker, is coming to Halifax Council in the first week of December. Commuter rail could be extended to Cobequid Road, Beaverbank, Elmsdale, and further, Mr. Speaker, making the daily commute much easier for thousands of people. So I'd like to ask the Minister, will the Minister agree today to actively partner with the municipality to establish a commuter rail system?
Here. The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker, and I've had the opportunity to speak to Mayor Savage and Council on a number of occasions. I don't have the specific details on this project, but what I can say is we continue to work with our federal partners to provide transit funding to the HRM and other communities across the province. We also provide other programs to support transit research in rural communities across Nova Scotia and to support communities who want to upgrade their buses to be more accessible. Specific to this project here, Mr. Speaker, I look forward to the proposal that will be before Council in future conversations with HRM.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. I'm a bit disappointed. I don't think I've seen anything in the budget that would lend support to this. Bringing commuter rail to Halifax area will not only make the city more accessible, it will take care, it is true for the member of Yarmouth, would take cars off the road. It would reduce congestion and reduce our carbon footprint, Mr. Speaker. We know that the municipality is already considering commuter rail, and Via Rail, Mr. Speaker, has come forward to express their willingness to work with the council. So all I'm asking, will this government do the same as Via Rail and partner with Halifax Regional Municipality to ensure commuter rail is finally available here in Nova Scotia?
The Honourable Minister of Municipal Affairs.
Thank you, Mr. Speaker. I'd like to thank the member for the question. As I said, we've had open dialogue with HRM on a number of issues that they want to bring forward to our department. Specifically, with this proposal, the private sector is going to play a big part in how it's rolled out. I haven't had the opportunity to see the details of that proposal. I look forward to seeing it, and I look forward to continued open dialogue with HRM.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. My question through you is to the Minister of Health. Mr. Speaker, as everybody's aware, I have the Cole Harbour Eastern Passage constituency with no family doctors at all, and we've been given permission to try to recruit one, so we're going to be starting that process next week, but we're not overly optimistic it'll be a speedy one. My question to the Minister of Health is, if we were able to secure a clinical nurse practitioner who was willing to come out to our community, would we be allowed to do that as a starting point to provide the constituents of my area with healthcare services?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the member's question. And actually, what I really appreciate is the member's recognition that the recruitment process is not a speedy process, Mr. Speaker, despite the suggestions that seem to be coming from the other side of the House most days, Mr. Speaker. So I do appreciate the member's acknowledgement that the process for recruiting physicians, primary care providers, does take time, and that this government is moving forward on those recruitment efforts, Mr. Speaker, and we continue to do that, Mr.
Order,
Speaker.
please. The Honourable Minister of Health has the floor.
To recruit, and not just recruit those physicians, primary care providers, Mr. Speaker, but to create an environment, to provide an opportunity that they'll provide long-term benefits, Mr. Speaker, through the residency program, through the clerkship program, Mr. Speaker. So I do continue to make those commitments, Mr. Speaker, and we'll continue in the
Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker, and I appreciate the answer, except what I really want to know is, can we have a clinical nurse practitioner there in the meantime while we're waiting to recruit a family doctor?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I again appreciate the question. Again, as part of the province, our commitment to provide primary care providers throughout the province, nurse practitioners are part of that process and part of the team, Mr. Speaker, providing primary care services across the province. So, Mr. Speaker, if the member or community believes they have the opportunity to bring a nurse practitioner to provide those services for her community, we'd certainly work with her to make sure that we get the appropriate funding in place for that, Mr. Speaker. She wants to connect with with me offside, we can have that conversation in a little more detail. Happy to do that.
The honourable member for Sydney River Myra Lewisburg.
Mr. Speaker, my question through you is to the Minister of Health and Wellness. Mr. Speaker, he says he doesn't think he'll have time to respond, but he never answers anyway, so it's how much difference. Mr. Speaker, it's come to my attention that nearly 40% of the people that attend the prosthetic clinic here in Halifax travel from Cape Breton. At one time, there was a service available in Cape Breton at the Sydney Mines Rehabilitation Centre where you could actually go and get adjustments and things of that nature done, so there wouldn't be a great deal of travel. I know one patient that has made 5 trips to Halifax in 5 weeks for a 15-minute appointment. My question to the Minister is, would he look at reopening the prosthetic clinic on the north side to cut down on travel of those who can't and don't have the resources to do it?
Honourable Minister of Health.
Thank you, Mr. Speaker. I believe the member from Cole Harbour Eastern Passage knows that I do answer questions directly, Mr. Speaker. To the question there, Mr. Speaker, I believe it came up in estimates, and I did commit to looking into it. Don't know if it'll be at that location or not, but Mr. Speaker, we'll look into the possibilities. Thank you.
Thank you very much. Time allotted for oral questions put by members to ministers has expired. We'll now